Hi, I'm Amber Valverde, and today I'll be talking to you about the career of an orthopedic surgeon. What does it really take to be an orthopedic surgeon? Is being a surgeon as glorious as you think it is? The path to becoming an orthopedic surgeon is a difficult one. It requires a lot of focus and determination if you want to be successful. Martin H. Fisher, a German-born physician and author who is famous for his practice of medicine, once said, "A doctor must work 18 hours a day and 7 days a week. If you cannot console yourself to do this, get out of the profession." As an orthopedic surgeon, you must be strong and trustworthy. I got interested in this profession because of Dr. Timothy Palomera, who was my orthopedic surgeon growing up that used to deal with my soccer injuries. He used to tell me that I should look into his career since I could already pretty much diagnose myself from all the injuries I had. Today, I'll be sharing key information about my career choice. I'll be giving you some background on the field of orthopedic surgery, share what I learned from an interview with a local doctor who is currently doing his residency, and talk briefly about the path and future of this career. Let's get started by talking about the background of this career field. According to the article, "Who Are They and What Do They Do?" by the American Academy of Orthopedic Surgeons, an orthopedic surgeon is a physician devoted to diagnosis, treatment, prevention, and rehabilitation of injuries. They deal with disorders and diseases of the body's musculoskeletal systems. This system includes bones, joints, ligaments, muscles, nerves, and tendons. The field of orthopedics has a long and rich history. According to Dr. Ishan Sarap and Joseph F. O'Donnell in the article An Overview of the History of Orthopedic Surgery that was published in the American Journal of Orthopedics, while the modern term orthopedics was coined in the 1700s, orthopedic principles were beginning to develop and use during the primitive times. The term orthopedics was coined by the professor of medicine Nicolas Audry at the University of Paris. Orthopedic surgery was popular in the Renaissance period. Hospitals and surgical techniques were beginning to be developed. In Egypt, one of the first medical books, called the Edwin Smith's Papyrus, was founded. In Greece, the scientific approach was developed, and in Rome, they began focusing more on the musculoskeletal and nervous systems as well as amputations. Now that you have heard some background on the field, I'll share what I have learned from a recent interview. Dr. Boaza is a thriving medical school graduate, who is now in residency for orthopedic surgery. He prepared for his career by earning a Bachelor's of Science in Biology and Chemistry. Then he graduated from medical school at UT Health Science Center in San Antonio. And after, he went on to residency, where he's currently working long hours. The worst part of medical school and residency are that there are crazy hours, patients cannot always pay, and there are lawsuits. The best parts are about changing people's lives and being able to fix their pain. According to Dr. Umar Bawaza, along with the issues associated with the cost of surgery, doctors often have to be wary of lawsuits. Any doctor even partly associated with a surgery that receives lawsuits gets written into the report. Many doctors are faced with a lack of respect from both the patients and even the nurses. Dr. Bawaza gave advice on pursuing this career. He said to stay focused, prioritize, make sure you really want this job, major in science, and get to know your professors so that they can give you detailed recommendation letters. Now that you have heard about the background of orthopedic surgery and the information from Dr. Bawaza's interview, let's look at the future of the field. The future of orthopedic surgery is secure. According to the article from the Bureau of Labor Statistics, employment of physicians and surgeons is projected to grow 14% from 2014 to 2024, much faster than the average for all occupations. But new technologies will allow physicians to treat more patients in the same amount of time, thereby reducing the number of physicians who would be needed to complete the same tasks. Dr. Bawaza also stated in his interview that robots and technology are on the rise, but humans are still needed to account for certain issues that robots cannot. This means that jobs in this field are currently rising, but technology might eventually catch up. According to award-winning healthcare writer Morgan Lewis Jr., orthopedic surgeons make around $475,000 annually, but wages can differ due to work hours and skills. In conclusion, let me briefly review what we have talked about. We have talked about the background of orthopedic surgery. We have went over the interview with Dr. Ahmed Bawaza, and finally you learned about the future of orthopedic surgery, including jobs and wages. I will finish off by talking about my future and path in this career. After my interview, I gained more motivation to continue pursuing this career. My plan after majoring in physics pre-med at the University of Dallas is to begin applying to medical schools and eventually attend schools such as UT Health Science Center here in San Antonio. My future life in working and helping patients as an orthopedic surgeon is my idea of a successful life. I will be proud to help people get their lives back so that they may keep on living with the people they love and doing the things that they love. Thank you.
That was good.